Hi, it's Isaac here, and today for my 3-minute video, I wanted to focus on healthcare in the United States, along with um, health insurance among vulnerable populations. And so, I want to start out. I've had quite a bit of experience in the healthcare space, being a CNA, working in healthcare, also being able to see a lot of how insurance works through my classes that I've taken and working in and around hospitals and health insurance systems. So it's pretty interesting. I want to focus first on the uninsured rate here in the United States. So it's 8.2% of the population is uninsured, which is actually the lowest it's ever been in the United States. And this is due to recent legislation like the Affordable Care Act and a lot of policies that have allowed people to get insurance. The problem with this number, 8.2%, is that most of these people are, vulnerable populations, the people that are uninsured. It's not necessarily people who can afford to pay out-of-pocket healthcare expenses. So the highest uninsured population is the Hispanic people, and followed by the American Indian and Alaskan Native people. And so those people are suffering from lack of insurance, lack of healthcare coverage, and we've really touched on that, I think, in our class going over the American Indian, and Alaska Native people and the Hispanic people in a couple of our class periods. And so this is a big problem because these people can't really afford healthcare coverage, and so they just don't really get healthcare. I saw this on my mission. I served in the Oakland, San Francisco, California area, and while there weren't a ton of American Indian, Alaska Native people, there were a lot of Latino people, a lot of Hispanics there, and I was able to see kind of those people were marginalized in a lot of ways and didn't have the same opportunities because of the financial burden of healthcare and insurance. And I want to pose, some more solutions to this. I think the biggest solution that comes to mind is Medicaid expansion for vulnerable populations. I know states don't necessarily want to spend more on Medicaid because it is a state program, but I think this could really help if federal and state funds kind of went together and the federal funding kind of incentivized the states to expand their Medicaid to include the growing immigrant population and the growing vulnerable populations in our country, especially as it concerns insurance.